This is Med School Radio. You're listening to Med School Radio. This is Simon. I'm back again, and we are going to read some more of the educational objectives. I'm doing this because it's really helpful for me to read them out, to make them stick in my mind, and I hope that that works for you too. So the last post we made in the last episode was on broad spectrum anticonvulsants, and we're talking about the broad spectrum anticonvulsants and the ones that are primarily used for focal onset of seizures. Let's just read that one again because it's short. Broad spectrum anticonvulsants, for example, levetiracetam or valproic acid, treat both focal and generalized onset seizures, whereas narrow spectrum anticonvulsants, for example, carbamazepine and phenytoin, are primarily used for focal onset seizures. Because the seizures in juvenile myoclonic epilepsy are usually generalized onset, so this was a question about a juvenile seizure. So because they are in juveniles usually generalized, for example, affecting both cerebral hemispheres at the onset, the treatment is with a broad spectrum agent such as valproic acid. Okay, moving on. Patients with Müllerian aplasia, i.e. Mayer-Rokitansky-Kuster-Hauser syndrome, have no upper vagina, for example, a short vagina, and a variable uterine development. These patients are 46XX females with normal ovaries and secondary sexual characteristics. Okay, we're still talking about the females and the female embryonic origins. In females, the paramesonephric ducts fuse to form the fallopian tubes, uterus, cervix, and upper vagina. Disruptions of this process can lead to a variety of Müllerian tract anomalies, and renal anomalies are a common comorbidity. Incomplete lateral fusion of the paramesonephric ducts result in bicornate uterus, characterized by an indentation in the center of the fundus. So it results in a bicornuate uterus, characterized by an indentation in the center of the fundus. Next one. Androgenetic alopecia is the most common cause of hair loss in both males and females. The pattern and severity of the baldness depend on both hormonal, circulating androgens, and genetic factors and vary between males and females. The condition is polygenic with variable expressivity. So that was androgenetic alopecia, hair loss. Vitamin A. Vitamin A overuse can result in intracranial hypertension, skin changes, and hepatosplenomegaly. Let's talk about aldolase B deficiency and fructose intolerance. Aldolase B deficiency causes hereditary fructose intolerance. This disease manifests after introduction of fructose into the diet with vomiting and hypoglycemia about 20 to 30 minutes after fructose injection. These infants can present with failure to thrive, jaundice, and hepatomegaly. So that was aldose B deficiency and fructose intolerance. Back to statistics. Negative predictive value, your favorite. Negative predictive value, or NPV, is the probability of not having a disease when the test result is negative. The negative predictive value will vary with the pre-test probability of a disease. A patient with a high probability of having a disease will have a low NPV with a negative test, but a patient with a low probability of having a disease will have a high NPV with a negative test. Cytomegalovirus, or CMV, is typically associated with subclinical infection in the immunocompetent, with the occasional individual developing a mononucleosis-like syndrome that is heterophile antibody or monospot negative. In the immunocompromised, primary or reactivated CMV infection can result in severe retinitis, pneumonia, esophagitis, colitis, or hepatitis. Let's talk about cancer statistics for women. According to the 2019 estimates, the most common cancers, excluding basal and squamous cell cancer, in women by order of incidence are breast, lung, and colorectal cancer. In terms of mortality, lung cancer claims the most lives, followed by breast and colorectal cancer. Let's talk about lymph. Most of the cutaneous lymph from the umbilicus down, including the anus below the dentate line, drains to the superficial inguinal lymph nodes. Exceptions are the glans penis and posterior calf, which drain to the deep inguinal nodes. Okay, let's talk about different types of aortic dissections. The intimal tear in Stanford type A aortic dissection, involving the ascending aorta, usually originates in the sinotubular junction, whereas the intimal flap in Stanford type B aortic dissection usually starts near the origin of the left subclavian artery. Dissections can propagate distally to the thoracoabdominal aorta. Okay, let's talk about heart failure and the kidney. The reduced cardiac output in heart failure triggers compensatory activation of the sympathetic nervous system and renin-angiotensin-aldosterone pathway, resulting in vasoconstriction, which results in increased afterload, fluid retention, which results in increased preload, and deleterious cardiac remodeling. These mechanisms perpetuate a downward spiral of cardiac deterioration, leading to symptomatic, decompensated heart failure. Let's think about Streptococcus pneumoniae. The primary virulence factor of Streptococcus pneumoniae is a polysaccharide capsule that inhibits opsonization and phagocytosis. The polysaccharide capsule of the most virulent strains is targeted by the pneumococcal vaccine, which confers immunity against those subtypes. Escherichia coli is the most common cause of urinary tract infection in both healthy adults and elderly patients. E. coli is a part of the normal gastrointestinal flora, and special adhesive proteins fimbriae allows some strains to colonize and ascend the urinary tract. This can result in UTI, pyelonephritis, or bacteremia and sepsis following access to the bloodstream. And UTIs are the most common cause of E. coli bacteremia. Okay, we're going to do about 5 more in this session. Primary varicella zoster virus infection, or chickenpox, occurs most commonly in childhood. Subsequently, the virus migrates to the sensory ganglia, where it lies dormant for decades. Over time, waning cell-mediated immunity allows reactivation of the virus, which spreads down a single nerve to cause a painful erythematous vesicular rash in a dermatomal distribution. Okay, we're going to talk about fungal infections. Patients with profound and prolonged neutropenia are at especially high risk for viral and fungal infections. The most common fungal causes are Aspergillus and Candida species. Invasive pulmonary aspergillosis presents with some combination of fever, chest pain, cough, dyspnea, and hemoptysis. Mycobacterial resistance to isoniazid, or INH, can be accomplished through non-expression of the catalase peroxidase enzyme or through genetic modification of the INH binding site on the mycolic acid synthesis enzyme. Next, babesiosis and Lyme disease are transmitted by the Ixodes tick and occur in similar geographic regions. Co-infection is common. So remember these together: the babesiosis and Lyme disease, the Ixodes tick. A couple more. Toxigenic strains of Corynebacterium diphtheriae produce diphtheria toxin, which irreversibly inhibits host protein synthesis due to ADP ribosylation of elongation factor 2. Local effects include pseudomembranous pharyngitis. Systemic effects include potentially life-threatening myocarditis and neuritis. Immunization with diphtheria toxoid generates protective circulating IgG against the exotoxin B subunit. So as with all of these, what you need to do is to be remembering the details in these sentences so that you can apply them to any of the vignettes. This is regarding Corynebacterium diphtheriae. So remember that it irreversibly inhibits protein synthesis because of ADP ribosylation of elongation factor 2. And immunization with the diphtheria toxoid generates protective circulating IgG against the exotoxin B subunit. Okay, and the last one for tonight, regarding Giardia lamblia, which is the most common enteric parasite in the United States and Canada, and it is a common cause of diarrhea in campers and hikers. Iodine-stained stool smear classically shows pear-shaped flagellated trophozoites or ellipsoidal cysts with smooth, well-defined walls and 2+ nuclei. Metronidazole is the treatment of choice. And I thank you very much.